Hello, I'm Barbara MacArthur. I'm the Vice President of Cardiac Services here at the University of Kansas Health System. In the United States, cardiovascular disease is the #1 cause of death. And most of those who die suddenly from cardiovascular-related disease either have no previous symptoms or are unaware of their own risk. Because of this, it's important to be aware of your heart health. And helping us tell the story this morning is Congresswoman Sharice Davids. Thank you so much for taking the personal initiative to talk about heart health during Heart Month. Why was this important to you?
Well, there are a couple of different reasons. I know that heart disease and cardiovascular health is something that a lot of us should be thinking about and spending time thinking about. And, it's something that also I know that you all are doing a lot of work around. And I felt like this was something that we really should be thinking about more and just getting the word out about.
You're absolutely right. And may I call you Sharice?
Yes, please, go ahead.
You took our online heart health quiz.
I did.
And it can be found at kansashealthsystem.com/heartquiz. And the quiz compares your actual age to your heart's biological age. And it estimates your risk of developing cardiovascular disease and then helps to prioritize the most harmful cardiovascular risk factors. The quiz uses a scoring system developed from the Framingham Heart Study. That study dates all the way back to 1948. It's named after the town of Framingham, Massachusetts, where the residents in the community, going back 3 full generations, were helping scientists understand why some people develop heart disease and others don't. So we know the questions we're going to ask can truly help determine risk factors for cardiovascular disease. Are you ready to talk about you?
Yeah.
So let's get started. On the first page of the quiz, it asks some personal information, and we're going to talk about the 4 critical questions on this page and explain why they're important. Those questions include ethnicity, whether you smoke, how much you exercise each week, and your stress level. So tell me about how you manage those 4 questions.
So on the smoking question, I grew up with people in the home who, like aunts and uncles and folks who smoked, and my cousin and I, when we were teenagers, would sometimes sneak out. And so when I answered the question, I had to put not in the last year, I think was the way the question was asked. How long since you smoked, or have you ever smoked? And that's something that I think is really important to note, just because I know a lot of times when you're young and you're around people who smoke, it might just seem almost like the thing to do, I guess, especially when I had an older cousin. And and then on the second question of exercise, I now that I'm in office and while I was campaigning, don't work out as much as I used to, but I still try to be active at least 3 or 4 times a week, and I walk. So one of the things that I do is in the mornings when I'm going to work, I spend about 15 minutes of the time walking instead of taking a bus or getting in a car. And then I like to go to the gym and use the stair climber and that sort of thing.
Good. Well, let's talk about those 2 risk factors.
Yeah.
Smoking damages the heart and the blood vessels. And we know that smokers have a much higher risk of cardiovascular disease, heart attack, stroke, high blood pressure. But we also know that it's never too late to stop smoking. So your story is not an unusual one. Good for you for stopping smoking. And I think that's an important measure and message to get out there. And in terms of exercise, remember that it's not always about going to the gym, because sometimes you can't get to the gym. And every amount of exercise during the regular activities of the day really do contribute to heart health. Take the stairs, walk around the building, park just a little further away, because over time that adds up to 15, 30, 40 minutes of exercise a day. And then save some time for the more rigorous exercise, but don't discount the exercise just during a regular day.
Yeah,
So.
and actually I liked that on the questionnaire that I filled out, it asked how many minutes of, I don't remember if it said exercise, but it's definitely shows you that there's kind of movement that you can do, and then rigorous,
Moderate exercise and rigorous exercise.
Yeah, and I liked that, because part of the reason that I try to walk as much as I can is because I know that if I'm just at least moving, that will help me.
Exactly. So. And there are many times, I'm sure when the legislature is in session, that you are sitting more in committee meetings and so forth, and many people with sedentary jobs where they spend the bulk of their time sitting. So just even getting up and walking down the hall and back counts. So good. The next question asks if you have immediate family that have been diagnosed with heart disease. And immediate means father, brother for male relatives, mother, sister for female relatives. And for the males, the age is before 55, and for females, before age 65. Do you have any immediate family that fits this description?
I don't.
Good for you, because you know we can't change heredity.
Right.
So that's good. And we'll come back to that, because there are risk factors that we can modify ourselves through our lifestyle, gender, family history, ethnicity. Those just come in the package.
Yeah.
So. Another important question is, have you experienced a transient ischemic attack, sometimes called a TIA or a mini stroke, or ever experienced any stroke symptoms?
No, I haven't.
That's good. Let's take just a moment for our viewers and our audience and our community just to remind folks of what the symptoms of a stroke are. Because one of the most important things with the symptoms of a stroke are to recognize them quickly and get help.
And I'd like to hear them too, just in case. If it ever were to happen to me, but if I were around somebody that was affected.
Just exactly. So we have a quick acronym called FAST, F-A-S-T. And F stands for face.
Oh.
So if there's some drooping in the face, or if someone smiles and the smile is not equal on each side, those are very simple tests. So face. A is for arms, and weakness in one arm or the other, usually one side, or if you raise your arms and one drifts down, another very simple thing that any of us could see in someone else. The S stands for strength, so profound weakness, and T is for time. So if there's speech problems, the S can also stand for speech. If there's slurred speech, dizziness, weakness on one side or another, or a change in the face, then the T is for time, and call 911 and get some help.
Okay, thank you.
Great. Do you have diabetes?
I don't.
Good. Diabetes is a disease that affects the arteries across the body, both in the heart and elsewhere in the body. And the important thing with diabetes is to know whether you do have it. From the high blood sugars are harmful to those vessels and make them harden or stiffen. I'm sure you've heard the term atherosclerosis or arteriosclerosis. So I'm glad you don't have diabetes. For those that you may know or love that do have diabetes, keeping the blood sugars under control is really the key for managing that risk factor.
Yeah.
Do you have any heart or blood vessel disease conditions? And so on that list, heart disease, heart attack, heart failure, stroke, we've talked about a little, angina or chest discomfort or pain, or none of those?
I haven't experienced any of those, and the last time I went to the doctor when they checked, I didn't have any symptoms of anything.
Good.
So.
And that's the reason that question is important. You will be asked those questions when you see your doctor or your healthcare provider, and you want to be sure that you remember if you have ever had any of that in your history. So good. Are you taking any blood pressure medicine? Any cholesterol or diabetes medicine? Probably not.
No, I haven't been.
Or any other heart-related medications?
No, I haven't. I feel like I've been very fortunate at this point. I haven't had the need to take many medications at all. So
good. And we do have medications. Science and research is helping tremendously with newer medications to help modify risk or treat the diseases. And the adherence and compliance and understanding of those medications is really important. So anyone that does take medications for any of those conditions, understanding them and taking them appropriately is very helpful.
Yeah. Can I
Please.
ask a question
Yeah.
really fast? Is that a place where if I have family members that are taking those medications, are there places that I can look maybe on websites or coming to maybe speak with a pharmacist or something? I'm just curious about that.
You know, clinical pharmacists or PharmDs are great resources.
Okay.
Many of the local drugstores, almost all of them, will have a pharmacist available.
Okay.
And even when you fill a prescription, the pharmacist or the pharmacy tech that hands you the medication will say, do you have any questions? And if they do, don't hesitate to ask for education and understanding from the pharmacist, as well as your physician or healthcare provider. But the pharmacists are pretty regularly available across the community and in clinics. They're a great resource.
Okay, that's good to know. Thanks.
So at this point, we're almost through the quiz. Next, the quiz provides a guide for determining your blood pressure, cholesterol, and blood sugar numbers. And the more total high and moderate risk factors you have with those next questions, the more likely you are to develop cardiovascular disease. So here we go. And let's look at your numbers or the numbers that you knew, okay? So what about systolic blood pressure or the top blood pressure number?
So not that long ago, I went to do a very quick checkup, and I remember them using the cuff on my arm, and I got I want to say it was either, and maybe tell me if I'm remembering this correctly, what the range is. It was either 119 or 109 over 60 or 68. For some reason, I can't quite remember. Okay. But those were. It was something like that.
Good.
And it seems like it's usually about the same when I go. So.
And blood pressure can vary across the time of day, across your activities, and so forth. So periodic checking is a really good thing to do. And the recommended goal is that the top number or the systolic number is less than 120, and that would be low risk. So when you remember 110, that's great.
Okay.
And the diastolic blood pressure, or the lower number, the recommended goal is less than 80. So if you were 75 or 72, that would be great.
Okay.
Okay. Total cholesterol, good cholesterol, bad cholesterol. Did you have those
And I
numbers?
haven't, no. So, can you tell me a bit about how people get those numbers? Because I don't remember the last time I've ever had that information. So,
Well, that's done via blood test.
okay.
And the blood test is done without eating before the test. And there's a total cholesterol number. And we're always looking for 200 or less. Certainly 150 or less would be low risk. And then the high density lipoproteins or the low density lipoproteins or triglycerides are all different fats in the blood. Some related directly to diet and some related to activity and heredity. So to get those numbers, that's a blood test that gives you a whole lipid profile, a whole picture. And so you would need to have the blood test and then speak to a healthcare provider about looking at those numbers and how they relate to each other.
Okay. Yeah, and I haven't done that in a while, I think.
Yeah, and you may not need to do that. Most of the time, those occur as you get a little older as part of your regular physical or annual checkup, or if you have heart disease in your family.
Okay.
And at that time, it's not unusual to do a fasting blood sugar also, which we've talked about just a little bit related to diabetes.
So can I ask one more question?
Sure.
We talked about immediate family, and maybe we were going to come to this, but we talked about immediate family, but at the my grandparents and then aunts and uncles, there's some of the issues that we've discussed were present in some of those family members.
And that's an important part of your history. We always look at first-line relatives, which are siblings and parents, but grandparents or aunts and uncles are all part of your family history, so you can never provide too much information. Now, somebody's mother-in-law's cousin, maybe not.
Okay. No, just kidding.
Yeah. Okay. The last page of the quiz asks for contact information, and we use that to communicate your results and provide opportunities for follow-up. So that's why that information is there. It will also ask if you have insurance, and this is to help understand some of the demographics of the population taking the test, those that do versus those who don't. And it's just, again, looking at the population, kind of like Framingham did. They looked at everybody in the community to see if we could learn about the community. Fill in your final answers, and the results are calculated almost immediately, as you saw when you took the quiz. And the first results reveal your heart age compared to your actual age. Do you want to share that?
Oh, yeah. I feel like it's right on the front.
Well, your real age
your heart
is...
age. So I'm actually 38, and my heart age looks like it's right around 30.
Okay. So heart age is a quick way to get a good idea of overall heart health. And it compares your risk against someone who has no risk factors at all. So that's why a heart age of 8 years younger is great. The next calculation is your risk of suffering a heart attack, stroke, blood vessel disease, or heart failure over the next 10 to 30 years if you are younger than the age 60. This risk assessment is really just for educational purposes only. It's for you to learn about yourself, for you to educate yourself on the factors, for you to know yourself, and then also follow up in either modifying your risk factors or seeking medical attention. So it's not a diagnosis, and your doctor might use a different assessment to help guide the intervention or therapy decisions for you. What did your calculations show?
It looks like I'm at low risk, and my 10-year risk is about 1%, and then my 30-year risk is about 8.7%. And I imagine, well, I guess this helps is when thinking about this, I'm guessing that is partly because of the level of activity that I said, and that also that I'm not smoking, and because of the systolic and oh, now I can't remember the name of the other one.
Diastolic.
Diastolic.
Yeah.
Is that
Yeah,
how
all of those measures feed into your picture.
Okay.
And again, some of those are behavioral because you are active and because you are conscious about healthy living and because you did stop smoking, and some of them are related to good genetics. So the final calculation shows how personal characteristics relate to your risk of cardiovascular disease in categories that you can change, such as smoking, such as modifying your diet if needed. And the final calculation also shows risk factors that you can't change, and we've talked about those. So your calculation told you what?
It looks like I have moderate risk for partly it's maybe because I have unknown for family history on a couple. I had to put unknown for a couple because I was raised by a single parent, so I only had one side of my family tree to think about, and then at low risk for some of the other things around age and gender and diabetes, and so I had low risk on 6 of the factors, and then 3 unknown risk factors as well. So
great, good. Thank you, Congresswoman, so much for sharing your personal heart assessment with us. It is very helpful in terms of teaching about this important tool. So we invite you to take your own heart health assessment at www.kansashealthsystem.com/heartquiz. Thank you for watching.